Hi, Eileen Veilleux The Fam here. Welcome to another installment in our mini mental health series. And in today's episode, we will be finishing up on bulimia by covering the diagnosis and treatment of it. Before we begin, let me just remind you to please watch the full video because in the video there will be three key words. When I get to the key word, I will say keyword, then what the keyword is. So at the end of the video, along with a genuine comment about the video, put in the three keywords you hear to be eligible for my 2,000 subscriber giveaway. So let's get started. How do you go about and diagnose bulimia anyway? Well, your primary care provider, if they suspect that you have bulimia, he or she will typically talk to you about keyword eating habits, weight loss methods, and physical symptoms. Do a physical exam, request blood and urine tests, request a test that can identify problems with your heart, better known as the electrocardiogram. Perform a physical evaluation, including a discussion of your attitude towards your body and weight, and use the criteria for bulimia listed in the Diagnostic and Statistical Manual of Mental Disorders, better known as DSM-5, published by the American Psychiatric Association. Your primary care provider may also request additional tests to help pinpoint a diagnosis, rule out any other medical causes for weight changes, and check for any related complications. So, knowing this, how do you treat bulimia? Well, when you have bulimia, you may need several types of treatment. Although combining psychotherapy with antidepressants may be the most effective for overcoming this disorder. Treatment generally involves keyword, a team approach that includes you, your family, your primary care provider, a mental health professional, and a dietitian experienced in treating eating disorders. You may have a case manager to coordinate your care. Here's a look at bulimia treatment options and considerations. Now, psychotherapy, also known as talk therapy, or psychological counseling, involves discussing your bulimia and related issues with the mental health professional. Evidence indicates that these types of psychotherapy can help improve symptoms of bulimia. Now, cognitive behavioral therapy can also help you to monitor your eating patterns, your eating patterns and identify unhealthy negative beliefs and behaviors and replace them with healthy positive ones. Family-based treatment is another way to help parents intervene to stop their teenagers' unhealthy eating behaviors. To help the teen regain control over his or her eating and to help the family deal with problems that bulimia can have on the teen's development and the family. Interpersonal psychotherapy, which addresses difficulties in your close relationships, helping to improve your communication and problem-solving skills. Ask your mental health professional which psychotherapy he or she will use and what evidence exists that shows it's beneficial in treating bulimia. Now, the medications involved with it are just like I said, basically antidepressants, which will help reduce the symptoms of bulimia when used along with psychotherapy. Now, the only antidepressant specifically approved by the FDA or the Food and Drug Administration that treats bulimia is Prozac, a type of selective serotonin reuptake inhibitor, better known as a SSRI, which may help even if you're not depressed. What about nutritional education? Well, that's always good. Dietitians can design an eating plan to help you achieve healthy eating habits. to avoid hunger and cravings, and to provide good nutrition. Eating regularly and not restricting your food intake is important to overcome bulimia. Now, bulimia can usually be treated outside of the hospital, but in some extreme cases, hospitalization may be required. So there is a chance that if it's extreme bulimia where you're nothing but you're not doing real well, they may require you to be hospitalized. Now, there are treatment challenges in bulimia because although most people with bulimia do recover, some find that symptoms don't go away entirely. Periods of binging and purging may come and go through the years, depending on your life circumstances, such as recurrence during times of high stress. Now, if you find yourself back in a keyword binge purge cycle, follow-up sessions with your primary care provider, dietitian, and or mental health professional may help you weather the crisis before your eating disorder spirals out of control again. Learning positive ways to cope, creating healthy relationships, and managing stress can help prevent a relapse. If you had an eating disorder in the past and you notice your symptoms returning, seek help from your medical team immediately. Okay, so, excuse me. So that's it on the bulimia. I don't recommend any so-called home treatment for it. It is just as bad as anorexia nervosa, which is where you basically starve yourself. A lot of it goes hand in hand with each other, because with anorexia you do that as well. And it does have severe circumstances, as you recall, on your health, like your heart, your your other parts of your body, like your digestive system and your stomach and things like that. And it does hamper your growth in a bad way. So if you know anybody or if you yourself are suffering from bulimia, talk to somebody. If you're not comfortable with talking to a doctor yet or a mental health provider, talk to a loved one about it. Seek help immediately. These mental disorders are not something to play with, and not something for you to play doctor with and see that you can do it on your own. They're here, that's what doctors are for, is to help you out. Now, I know we all don't like medications, but medications do help. Also, if you suffer from any of these mental disorders, please, I encourage each and every one of you, look into what I have put down for some anti anxiety and stress relief videos that I've done on the different techniques and methods you could do to help relieve some of that anxiety and stress that you're going through. It will help you to manage it better and less chances of these mental illnesses to really get out of control. And always remember, none of the things I mentioned is a substitute for medical help. Always take the medications your doctor prescribes. Talk to them about these different other techniques to go along with the medication. Not replace, to go along with. It will help you to manage your life. Always be in the know with your doctor, your family, and anyone else involved. And now my little message to you is I want you all to know that you all matter. You're all wonderful in your own ways, because we were all uniquely made, and we all matter. There's not one of us that is any better than any other. And for us to live a good, healthy, happy life And believe me, that comes from the way you act a lot of times. Our mental health, a lot of it deals by environment. As you learn in a lot of it, environment has a lot to deal with mental disorders, along with the food we eat, of course, and other things. But if we can narrow some of the things down, like our diet, so we're eating good and healthy, and if we can control somewhat of the environment, now we can't control what everybody else is thinking or doing, but we can control our own thoughts. Because when you think positive and you react and do positive things in your life, like helping people, encouraging them, lifting them, inspiring them, you release endorphins inside of your body that helps heal your body, both physically, mentally, emotionally, and spiritually, in all four aspects. Now, the same effect, except for a negative effect, will happen when you're not positive but negative. You're going to release negative hormones inside your body. And them negative hormones are going to bring you down mentally, physically. You'll find you're going to feel sicker more often. Emotionally, you're not going to be where you want to be. Spiritually, so it has benefits not to the just to the other people involved, but to you yourself. So remember to always see with your heart and not with your eyes, because your eyes can be deceiving. You can look at a book cover and say, "Oh man, this is going to be so awesome." Buy the book, bring it home, open it up, start reading, and say, "Man, I really wasted my money on this. It's not what I thought." Because the book is just like our thumbnails on our videos. It's much more than the picture. Just like a person is much more than what you see. What counts with a person, the eyes can't see because they're not see-through. They can't see the soul. They can't see the personality. Have you ever heard the expression of someone that's really, really pretty on the outside, but somebody calls them ugly? It's because what's inside of them destroys all the outer beauty. The outer beauty fades with age. That's why, like models, you don't see older models out there. You see young, models in their early, late teens to like in their 30s, young 30s. After that, they're out of job. Unless they spend all this money for all these fake surgeries and stuff. But then that part's still not real. Because they've had to have all this Botox for their face. It's not natural. Natural beauty comes from within. And if we can ignore what the eyes see and start looking with the heart, we can see the natural beauty or the natural ugliness of somebody, unfortunately. But even if somebody's ugly, does not mean we have to be that way. We can choose whether we want to be beautiful on the inside or ugly. I may look ugly to you this way. I don't know. And personally, I don't care what anybody thinks. I'm beautiful to me on the inside. Now, it doesn't mean I'm conceited. It just means I've learned to see with the heart. So remember out there, You are special. You all matter. And you're all important. And if we ever talk, and I say something to you, I say it out of love. If you get upset with what I say, I am so sorry. I don't want to hurt you. I'm not trying to hurt you. And, yeah, sometimes it may just be my opinion. But I will always try to uplift, encourage, and inspire you. And if I think I see something that is going to give people a bad image of you because of your actions, because that's what I'm talking about from the heart. Your actions speak louder than words. And that's why we need to act kindly and lovingly and have understanding. Okay? So until we see each other again, remember out there, you matter and I love you for you. Bye.